Okay, this video is intended for my patients or anybody that has access to this private YouTube video. This video is how to use vaginal estrogen. Vaginal estrogen is often prescribed in an applicator. Unfortunately, whenever you put something inside the vaginal canal with an applicator, it just goes up, it doesn't really absorb, and then whenever you stand against gravity, it pushes out. So, the inside of the vaginal canal, the reason why we're using estrogen is as our estrogen drops during perimenopause, not only is the vaginal canal, it starts to become less lubricated naturally, but the external genitalia also become problematic. So the clitoris, which is located at the top labia minora, which is going to be the inside, and labia majora, which is the vulva on the outside that has the hair. So if you pull back as you age, the clitoris actually starts to shrink. We don't want that. So the vaginal estrogen will help keep that nice and plump, as well as the labia minora. And if you notice right here, this is the vaginal opening. That tiny hole right there is the urethra. They're so close together that the microbiome in both of those need to be nice and happy. What keeps microbiome happy? Estrogen. And so I'm fixing to show you how to use vaginal estrogen appropriately as prescribed by your provider. And that way we are preventing frequency and urgency, UTIs, bleeding during intercourse, and keeping labia minora inside of the vaginal canal, the urethra, and the clitoris nice and happy throughout menopause. So when you get a tube or a click dial, you want to place it on your finger. So I'm going to use this as an example, and what you want to do is you want to put it on your finger, like that. Now, it could probably go a little bit more, a little plump at the end. And what you do is you will actually insert your finger into the vaginal canal as far in as you can. Then you're going to move it around. The inside of the vaginal canal is a 360 turn. You want to go in, around, and then come out. And when you come out of the vaginal canal, you're actually going to pull your finger upwards towards the clitoris. Put a little bit, spend about 10-15 seconds on the clitoris, and then rub it into the labia minora. This whole process should take at least 2 minutes. This is not something